Good evening, students. Today we are going to see about the neurotransmitter serotonin and some words about the disease migraine, in which serotonin plays a vital role. Serotonin always means confusion, because some of the students may try to read the serotonin prior to the class itself. We found that how much tough the subject it is and how much complex it is. Why this confusion occurs? Because the serotonin action itself very complex, and the disease in which the serotonin plays a part itself is another complex, and the drugs which act to the serotonin neurotransmitter, it's another complex subject. So all the triple complexity makes the learning of serotonin a very toughful or very tiresome. So when we see in the book the serotonin topic, which appears like so much clumpy wires, at the end of the topic I try to make it as simple as possible. The next 15 minutes, don't worry, we are going to discuss only about 15 minutes. We are going to learn about different type of serotonin receptors, what is the basic physiological actions, and what are the drugs available which act to the serotonin receptors, and what are the disease caused by these serotonin neurotransmitters, and how these drugs are effective in this treatment of serotonin based disease. So serotonin receptors are almost 7 types. They are numerically arranged 5:1, 2, 3, 4, 5, 6 and 7, and 5:1 has subtypes 1A, 1B and 1D, and 5:2 also has subtypes 2A, B and C. So that physiological action is so much complex. If you want to learn, you can see this slide and you can remember the physiological action. So as I already said, it's so much clumsier here. I try to make as simple as possible, even though there is so many type of 5-HT receptors are there. 4 receptors are very pharmacologically important: 5-HT1, 2, 3 and 4. For 3 and 4, there is no need to remember the subtypes. You just remember 5-HT3 and 5-HT4. But for 5-HT1 and 5-HT2, kindly remember the subtypes also. For 5-HT2, the important subtype is 2A bar C. Almost the C and C are similar type of receptors, so they are given as 2A bar 2C. And 5-HT1, remember 5-HT1B bar 1D. That is subtype. And also remember 5-HT1A. So if it is so much complex, at least remember there are 4 receptors for serotonin: 5-HT1, 5-HT2, 5-HT3 and 5-HT4. So even if you're not able to recollect all the important physiological function, at least remember these 4 subtype receptors functions. 5-HT1D, which causes vasoconstriction. So for the disease with vasodilatation, we can use this vasoconstricting substance. Certain diseases, not for all the diseases. I am here try to imply that in migraine we can use 5-HT1D agonist. 5-HT2C, which related with anxiety. 5-HT3, which related to vomiting. 5-HT4, which increases gut motility. Once again, remember this: 5-HT1D, which causes vasoconstriction; 5-HT2C, which related to or it may cause anxiety; 5-HT13, which result in drug-induced vomiting; 5-HT4, which result in increasing gut motility. If you remember this physiological action, then their pharmacological actions, understanding their usage in the disease is very easy. So as I already said, you remember these 4 types of receptors: 5-HT1, 2, 3, 4. Among these 4 receptors, for 5-HT1 and 4, the agonists are pharmacologically used. The substances which stimulate 5-HT1 receptor and 4 receptors are used as drugs for the treatment of disease. For 5-HT2 and 3, the antagonists are used for the treatment of the diseases. So for 1 and 4, the agonists are used for the treatment of the disease, and 2 and 3, the antagonists are used for the treatment of the disease. Now we are going to remember what is the agonist and what are the antagonists are used to have pharmacological importance. The 5-HT1B and 1D agonist triptans and 5-HT4 agonist metoclopramide. These triptans are used for the treatment of migraine. Migraine is unilateral headache. 5-HT4 agonist metoclopramide, which is a prokinetic drug, which has some antiemetic actions also. That is used for this agonist are used in some GI related problems. 5-HT2AC antagonist risperidone, which is an atypical antipsychotics, which is used for psychotic problems. 5-HT3 antagonist ondansetron, which is useful for drug induced vomiting. So remember this thing, 5-HT1 and 4 agonist are useful for the treatment of disease, and 5-HT2 and 3 antagonists are used for the treatment of disease. To simplifying these things, as I already said, 5-HT3 and 4 are very simple, though you no need to remember the subtypes. The 5-HT3 antagonist ondansetron is used for drug-induced vomiting. 5-HT4 agonist, which is used for some GI disorders. When it comes to with 5-HT1 receptors and 2 receptors, you should remember the subtypes also. 5-HT1A agonist buspirone is used for an anti-anxiety drug. 5-HT1D agonist is used for treatment of headache, unilateral headache, migraine. 5-HT2AC antagonist like risperidone, which is used for as an antipsychotic drug. It's very simple. I made this complex picture to as much as simple as possible. Just remember subtypes of 1 receptors and 5-HT2 receptors. For 5-HT3 and 4, you don't need to remember the receptors. In 1 and 4, agonists are used. 2 and 3, the serotonin antagonists are used for pharmacological treatment. If you remember this and if you correlate with physiological function, it's very easy for you to remember. Finally, here comes to the discussion of migraine. Migraine is nothing but some type of a headache. Mostly it is a unilateral headache. As you see in the picture, the first one is sinus headache, second one is tension headache, and the third picture is the migraine. If you see the migraine, it's mostly that unilateral type of headache. There are 2 types of migraines there. The most common migraines occurs without aura. Some migraines may occur with aura. Aura means some prequel symptoms, like before experiencing the headache proper, they may experience some kind of blind spots, flashing lights, or floating lines. Some type of aura they may get before or during the development of symptoms. When we go deep into pathophysiology, as I already said, the serotonin involving disease are very complex to understand. But for the migraine pathophysiology, there are so much complexity there. There are 2 things which cannot be underestimated. The 2 important things associated with migraines are vasodilatation as well as neurogenic inflammation. These 2 things are there. We should counteract these 2 things for the treatment of migraine. So as I said, 2 important things, inflammation and vasodilatation, which occurs during the acute attack of migraine. You should remember this occurs during an attack of migraine. When the person experiencing the headache, the person has 2 important pathophysiological features. One is an inflammation, another one is vasodilatation. This inflammation can be dealt by using anti-inflammatory drugs, simply called as non-steroidal anti-inflammatory drugs, NSAIDs. We are discussing this very elaborately about these drugs in coming classes. Second, important thing occurs in the migraine pathophysiology is vasodilatation. This vasodilatation can be counteracted by 2 drugs. One is triptans, another one is ergots. When we deal about these ergots, the ergots, as I already said, a complex drug which act through serotonin receptor. which may be an partial agonist or antagonist, act through serotonin receptors, alpha receptor, even it may act on dopaminergic receptors also. So these actions are very complex. As I ask our students and go and prepare, elaborate about these ergots, because we are still in some places we are using ergots. Like your students' homework for you, you should go and learn about the use of ergots. As I mentioned about triptans, hope you all remember where this triptans is act. It mainly act on serotonin 1 receptors and the two 1B bar D receptors. This triptans has this 1D receptor used to causes vasoconstriction. It helps in the treatment of migraine. Migraine can be classified into mild diseases, moderate and severe diseases. For mild diseases, simple anti-inflammatory drugs itself enough. The case of moderate and severe diseases, two things we should be focused. Here only we should use these vasoconstricting drugs like triptans or ergots. Since ergot contains so much of adverse effects nowadays, mainly the triptans are preferred. The ergots are now mostly unpreferred. Not we are not using ergots for the commonly for a treatment of migraine. Only we prefer triptans. Only when triptans are not available, we may search for the ergot, but not in the otherwise. We mainly use triptans for the acute attack of migraine. But in the case of the severe diseases, the patient suffers a lot. So we need some prophylactic drug to prevent the attack of this migraine. It's not a simple headache. It's sometimes very devastating type of headache. The patient feel very sick and ill. So in some severe cases, we need to use prophylactic drug to postpone this attack or to prevent the further attacks of this migraine. So these are the different type of triptans available for the treatment. Pathogenesis, I'll simply repeat it. Here the adverse effects of triptans. Mainly these triptans causing vasoconstriction, so it should not be used in the patient with coronary artery disease or some kind of other vascular diseases where the vasoconstriction is a real problem, and it's also contraindicated in pregnancy and liver and as well as renal diseases. As I already said, in the case of severe diseases, we need some kind of prophylaxis. The important drugs available for prophylaxis is propranolol, metoprolol, topiramate, valproate, flunarizine, amitriptyline. So students should understand the drugs used for the treatments are non-steroidal anti-inflammatory drugs, triptans or ergots. For prophylactic, we are using propranolol, topiramate, valproate, flunarizine or amitriptyline. Mainly beta blockers like propranolols are preferred. Whenever there is some contraindications for propranolol, we may go for other group of diseases. Nowadays, if you see the serotonin, the drugs which act on serotonins are very helpful in the treatment of migraine. So we postulated that the serotonin plays a very important role in the development of migraine. For example, the triptans which act through the serotonin receptors, which gives very good symptomatic improvement in the patient suffering from the attack of migraine. So we postulated that serotonin plays a very important role. Similarly, nowadays scientists picked up that another mediator called as calcitonin gene related peptide CGRP also plays an important role in the development of this migraine. So nowadays they develop so much monoclonal antibodies against this calcitonin gene related peptide, which found to have very good role in prophylactic treatment of migraine. So I think I made this complex subject into very simpler and linear one. Students should I lay the foundation. The students should learn more from the textbooks and should improve their knowledges about serotonins and the disease it's involved and the drugs it used for the treatment. Hope we are all not develop bilateral headache by this lecture. Try to keep it as simple and read very fluent. Stay home, stay safe. Thank you.